This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh and we're standing in front of the rehab pool, one of the many unique tools they have when it comes to rehab services. Now today we're going to be talking with David Corso and he's going to tell us about the many different types of options that people have when it comes to therapy and programs and the services in the rehab department. And David, thanks for joining us today. You know, when we talk about rehab services, there are basically 5 types of therapy, and we'll break them down for everyone. Let's talk a little bit about physical therapy. Who would be typically looking for physical therapy?
Sure. Physical therapists primarily work with individuals that have gross motor problems. So whether that's difficulty with walking or any orthopedic problems of the spine would be another example.
Sure. And then when it comes to occupational therapy, obviously that's job related.
Yes, it can be. Occupational, as the word describes, can be job related. One thing that differentiates occupational from physical therapy is that occupational therapists work with individuals that have fine motor disorders. So more so they're working with individuals that have hand, wrist, elbow, or shoulder problems, whereas physical therapists are working with pretty much the rest of the body.
Yeah, so you're very busy here in the rehab service department, and it expands to speech therapy as well.
That's correct. Speech therapists work with individuals that have swallowing disorders or problems with speech, whether that is talking or being able to understand individuals that are talking. Some of the common problems they work with. Okay,
and I understand that you also do massage therapy. What's that all about? It's not just a relaxing massage, is it?
Correct. It can be. Most people do access massage therapy for relaxation. We offer anything from a 10-minute chair massage to a half-hour or a full-hour massage.
And what's the benefit to that?
The benefits to massage can be significant, whether it's stress reduction, relaxation. There are cardiovascular benefits to that as well, and also to sore muscles and joints.
And you know, for a lot of the younger viewers, and maybe some of the older athletes that still like to get out there and play, you have athletic therapy.
That's correct. We cover a variety of sporting events in the community throughout the year, and if and when people do become injured, we are able to assist them return from their athletic injuries back to participation.
Yeah. Now let's talk about some of your locations, because I know you're not just in one spot.
That's correct. We offer services in Oshkosh at 2 locations, at the hospital on West Haven Drive, also at 712 Doctors Court. We have therapy at Neenah, Wautoma, and in Fond du Lac.
Okay. Now when we're talking about therapy, are there specific programs that relate to one therapy or another?
Yes. Within physical, occupational, and speech therapy, we have a multitude of programs which allow us to specialize in different areas and really help individuals that have different unique problems. For example, some of the programs within physical therapy include orthopedics, sports medicine, spine rehab, continence for patients, pediatrics, working with individuals with neurological disorders, even balance issues or falls, osteoporosis, cancer rehab. Within occupational therapy, some of the different programs include hand therapy. We have some certified hand therapists that work with individuals that have very complex hand, wrist, or elbow disorders. They're also involved with cancer rehab, pediatrics, neurological disorders, treating patients that have lymphedema. Speech therapy has a couple of unique programs as well. We have speech therapists that are able to work with individuals that have swallowing disorders, speech disorders, a unique, oftentimes misdiagnosed disorder called vocal cord dysfunction, and also Parkinson's disease our speech therapists are able to help with. And also pediatrics, young children that have difficulty with their speech.
Yeah, it's such a wide range of things that you do here in the rehab service department. And I know this is a tough question because there are so many areas, but when a person is in therapy, is it a short-term deal or is it something that's going to be basically a lifetime therapy program?
It can be both. Oftentimes we can see individuals for 1 or 2 visits depending on their problem. Some problems can be helped very quickly with 1 or 2 visits. Other problems may require a couple of months of therapy. For example, a patient after a rotator cuff repair, a surgery of the shoulder, they may come to therapy for as long as 3 months or more.
And again, when you're talking about therapy, it's not always surgery related.
Correct. It can be surgery related, but more often than not, more people we work with can be non-surgical related. And that is because a lot of the different programs that I mentioned allow therapists the opportunity to help people with a lot of different problems, and surgery isn't always the correction to their problem.
Right. And if people have questions or they're not sure if they should use your services here at Rehab Services, can they contact you directly, or do they have to see their healthcare provider?
To get an order to come for therapy services at one of our facilities, an order from their medical provider is required. However, patients are able to give a call if they just want to ask a question to see if their problem can be helped. And myself or one of our therapists would be happy to answer questions for them.
Yeah, so you guys get into so many different areas. I'm sure there's a lot of questions out there, so you're the guy to get a hold of.
That's correct.
All right, David, thanks for taking some time with us today.
Thank you.
Now, if you have any questions about any of these therapy options that David was talking about, you can certainly give the rehab department a call at 920-456-7100. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.